now we start the last talk in first session with Dr. Heba Gebril, effect of implementing a health education program on self-management, practices and quality of life among adult patients with epilepsy.
تمام.
Welcome, Dr.
في البداية بحب أشكر الدكتورة عايدة على دعوتها ليا للمشاركة في المؤتمر. الموضوع اللي أنا هتكلم فيه ليه علاقة وثيقة بالموضوع اللي اتكلمت فيه دكتورة جيهان. هي دكتورة جيهان اتكلمت في الإبليبسي عن النيرسز، يعني النيرسز المفروض يعرفوا إيه ويعلموا البيشنت إيه. مهم جدا في التيم اللي بيعمل تريتمنت للإبليبسي البيشنت نفسه، البيشنت وكمان الكير جيفر بتوعه. يعني أنا وأنا بعلم البيشنت كنت واخده برضو ان انا لازم يبقى في حد من الكير جيفر موجود وانا بدي الاديوكيشن، لان هم اللي بيقوموا بالرعايه للمريض في البيت في وقت الكونفولجن خاصه. تمام. انا هدي انترودكشن بسيطه كده عن الموضوع. Epilepsy is one of the most prevalent serious neurological disorders worldwide. It is a huge health problem affecting about more than 69 million people worldwide. According to the proposal of the International League Against Epilepsy, it is defined as a disorder of the brain characterized by predisposition to generate epileptic seizures and by the neurological, cognitive, psychological, and social consequences of this condition. The prevalence and the incidence of epilepsy is varying among the countries. In the United States and in Europe, the average annual incidence of epilepsy is about 55 per 100,000 persons. Men tend to be affected slightly more than women. An approximate 724,500 people with epilepsy live in the Arab world. Egypt is characterized by a relatively high incidence and prevalence of epilepsy. In Egypt, the prevalence rate is 9.3 per 1,000 persons and the incidence rate is 1.5 per 1,000 persons. Epilepsy as a chronic illness is linked to many economic, social, physical, and psychological consequences in all life dimensions. So, many difficulties have been reported in living with this illness, such as anxiety, effect of stigma, lack of independence, cognitive dysfunctions, and low socioeconomic status. Furthermore, epilepsy is associated with significant comorbidities and mortality, including all healthcare domains. All these consequences disrupt patient daily life and their quality of life. Epilepsy is a widely recognized health problem, but it is poorly understood, even among people who know someone with this disease. Lack of knowledge and understanding about epilepsy, its causes, has been associated with negative attitudes, beliefs, and stigma in the workplace, in school, and everywhere. The nurse has a pivotal role in caring for patients with epilepsy. As she is the primary health care provider, spending more time with patients than other professionals. Nurses are in unique positions to interact with family members. They can provide knowledge, skills, and support necessary to maintain the quality of care at home and play an important role in empowering family members. The provision of good quality care, relevant education about the epilepsy is one of the most important roles that the nurse should undertake. Epilepsy education helps people with epilepsy to become self-confident, competent in self-management, and help them become better partner in patient-centered care. Moreover, having accurate, in-depth information about epilepsy helps people better understand this disorder, prevent misconception, and reduce concern about stigma. Self-management plays an important role in the achievement of seizure control, improve satisfaction, and reduce mortality and morbidity. Self-management aims to reduce patient skills and confidence in monitoring symptoms, problem-solving, decision-making, goal-setting, communication, and adopting healthful behavior to improve health. Finally, epilepsy education promotes optimal well-being and quality of life. Health education addresses self-management practices among people with epilepsy, such as medication management, safety concern, physical activity, sleep and comfort, stress management, and managing cognitive deficits. This study aims to determine the effect of implementing a health education program on self-management practices and the quality of life among adult patients with epilepsy. 3 hypotheses were proposed. Number 1, adult patients with epilepsy who receive health education exhibit higher knowledge mean scores than those who don't receive. Adult patients with epilepsy who receive health education exhibit higher self-management practices mean scores than those who don't receive. Adult patients with epilepsy who receive health education exhibit higher quality of life scores than those who don't receive. A quasi-experimental research design was utilized. This study was conducted at El Hadra Orthopedic and Traumatology University Hospital. A random sample of 80 adult patients suffering from epilepsy was selected from the above mentioned setting. Age group from 20 to 60 years old have a diagnosis of epilepsy for at least 1 year, able to communicate verbally, receiving anti-epileptic drugs, had a stable clinical condition at the time of assessment, free from any psychotic disorders, and finally free from any other chronic disorder not scheduled for brain surgery. The study group composed of 40 patients who received subjected to the designed health education program plus the routine hospital care. The control group, 40 patients who exposed to the routine epilepsy care offered by their clinic. 3 tools were used for this study. Tool 1, epilepsy patient knowledge structured interview schedule. It was used to assess patient knowledge in relation to epilepsy. It was divided in 2 parts. Part 1, socio-demographic data, gender, age, occupation, educational level, marital status, residence area, and clinical data, which include age at first seizure, duration of illness, family history of epilepsy, presence of aura and its description, type of seizure, and seizure triggers. Part 2, patient knowledge related to meaning of epilepsy, causes of epilepsy, seizure triggers, aura, sign and symptoms related to epilepsy, problems and complications of epilepsy, risks that should be avoided to prevent hazard during seizure attacks, anti-epileptic drug side effects. Tool 2, epilepsy self-management scale. It was used to assess what people do to manage their epilepsy and the frequency of using epilepsy self-management practices. This scale was categorized into 5 subscales: information management, lifestyle management, medication management, safety management, and seizure management. Tool 3, quality of life in epilepsy inventory. It was used to assess health-related quality of life for patients with epilepsy. It contains 7 multi-item scales that include the following health domains: energy and fatigue, emotional well-being, cognitive functioning, social functioning, medication effects, and seizure worry. Overall quality of life دي الجزء الأخير فيها. The health education program was designed by the researcher based on assessment phase and recent review of literature. The program was then designed to be introduced to patients in Arabic language. The educational content was delivered in 2 parts through 4 sessions. The first part was delivered during the first session and consisted of education about the medical aspect of epilepsy. The second part was delivered during the subsequent 2 sessions and consists of education about self-management practices. The 4th session allocated for reinforcement and answering of patient questions. The illustrative educational booklet was developed by the researcher in simple Arabic language with simple pictures and distributed to each patient in the study group as in an illustrative guide for more clarification. ده كان اكزامبل كده من صفحه من الكتيب اللي انا كنت عاملاه. ده بيتكلم عن الاسعافات الاوليه للمريض في خلال النوبه بتاعه الصرع. The study was conducted according to the following steps. Official written permission to conduct the study was obtained. Written approval was taken. Tool 1 was developed by the researcher, Tool 2 and 3 was adopted. The developed Tool 1 and health education booklet were tested for content validity. The reliability of the developed tool and the translated Arabic form of Tool 3 was assured. Informed patient consent was obtained. A pilot study was carried out. Data collection was carried out over a period of 7 months. The study was carried out in 4 phases: assessment, planning, implementation, and evaluation. Evaluation conducted after 1 month post-implementation of the program using the 3 tools. After completion of the study, each patient in the control group was supported by giving the educational booklet that contains the content of the educational program as an illustrative guide. Distribution of studied patients according to their socioeconomic characteristics. The highest percent of patients in the study and the control group were males, married, didn't have enough monthly income from the patient point of view, and read and write. Distribution of studied patients according to their clinical data. The highest percent of patients had generalized seizure, received polytherapy, and reported stressors as the main trigger for seizure. Comparison between the study and the control group pre and post implementation of health education program. It was found that the mean percent score of patient knowledge of both groups before program indicating poor knowledge level. This, however, increased after 1 month and 3 months post-program implementation, indicating a good knowledge level. Comparison between the study and the control groups pre and post-program implementation in relation to mean percent score of total epilepsy self-management practices. It was found that there was no statistically significant differences between both groups before program implementation, while highly statistically significant positive correlation differences detected after 1 and 3 months post-program implementation. Comparison between the study and the control groups pre and post-program implementation in relation to all domains of health, of quality of life. It was found that there were no statistically significant differences between both groups before program implementation, while highly statistically significant differences were detected after 1 and 3 months post-program implementation. Correlation between knowledge of the study and the control groups and their self-management practices and the quality of life overall score and the pre and the post-implementation of the program. As regards the study group, there was a highly statistically significant positive correlation between mean percent score of knowledge and both epilepsy self-management practices and overall quality of life at 1 and 3 months post-program implementation, while there is no correlation regarding the control group. Correlation between self-management practices of the study and the control group and their quality of life overall score. As regards the study group, there was a highly statistically significant correlation between epilepsy self-management and overall quality of life, while there is no correlation between the control group. Based on the present study finding, it can be concluded that knowledge mean percent score of the studied patient of the study group were highly statistically significant improved post-program implementation, as well as the mean percent score of total self-management practices of the study group were highly statistically significant improved post-program implementation. Moreover, the quality of life overall score of the study group were highly statistically significant improved post-implementation of the health education program. It can be recommended that from this study for patients with epilepsy and their family members should seek ongoing health education about epilepsy and its self-management practices from a specialized healthcare provider to improve their health and the quality of life. Patients with epilepsy should apply the learned knowledge and self-management practices related to epilepsy in their everyday living to improve their quality of life. For nurses should attend updated conferences and in-service training programs or workshops about self-management practices of epilepsy to be learned to their patients. Manual guidelines should be available for nurses working with patients with epilepsy about recent updates in epilepsy management and care. For administrators, a colored illustrated booklet that updated periodically, including all health-related knowledge and self-management practices about epilepsy, should be available and distributed to all patients with epilepsy about their disease process and therapy. Specific rooms for health education programs for patients with epilepsy should be available at any time to teach patients about epilepsy management. Further research is recommended to be done to determine awareness, knowledge, and attitude of nurses toward the patient with epilepsy. Further research also needed for larger number of sample as well as long period of study time to confirm the result of the current study. For mass media, it is essential to increase the level of awareness among public, patient, and the healthcare provider regarding the epilepsy and its management practices through mass media to reduce the discrimination and social stigma that surround the epilepsy. Thank you.
ثانكس دكتورة هبة. طبعا ما شاء الله يعني هي شغل فيها شغل كتير جدا جدا. انا بس هأيد كلامك وكلام دكتورة جيهان، وفعلا الابيليبسي تريجر اللي هي الستريسور، وانا اشتغلت على الحالات دي ولقيت فعلا ان الناس دي لو حضرتك هتبصي على الداتا اللي حضرتك حطاها ان هم ميل، ان هم ريد اند رايت، الانكم بتاعهم قليل، فهو اساسا بيشتغل شغلانه يا اما كان مكواجي اللي انا اشتغلت عليهم، يعني لقيتهم كان معظمهم الشغل بتاعهم كان مانيوال، كان مثلا اكزامبل يعني كان مكواجي كان عامل نظافه، فهماني؟ فده الدخل بتاعه مش مكفي، الميديكيشن بتاعه لازم يروح ياخده من السنتر في الحضره.
كمان دكتور الميديكيشن مبني على التبرعات.
ايوه بالظبط انا عارفه، ده صندوق عاملينه هناك في مستشفى الحضره وبيجيبوا بيه الادويه. في وقت انا ما كنت بجمع الداتا للاسف الصندوق ده كان فاضي وما كانش فيه ادويه، فكان كل الحالات اللي بتيجي عايزه تاخد الادويه ما فيش، يعني كان في حاجات تانية كده كانت بتطلع يعني، فكان بتجيلهم بقى الحالات. يعني كنت بسال اخر مره جات لك امتى؟ يقول لي امبارح عشان الدواء خلص، فبالتالي هو ما معهوش انكم، الاتاك بتزيد يعني. فحقيقي الناس دي عندها معاناه كبيره جدا، لازم يتوفر لها اماكن مخصصه عشان يتعمل لهم education، لازم يتبعوا في البيت اللي هي الكير جيفر بتوعهم، لازم يروحوا معاهم ويعرفوا ايه هي الانستراكشنز دي، لان هم للاسف ان تارجت كبير قوي في المجتمع، يعني لازم ياخد مننا انتباه كبير جدا يعني. شكرا دكتوره هبه.
أنا بشكركم كلكم الحقيقة لإنجاز جميل جدا وتوكس رائعة وفي وقت ضيق جدا. بوجه لكم الشكر فعلا، أول مؤتمر نحضر له في الوقت الوجيز ده، وسامحونا، وببلغكم برضو تحيات الدكتور سامح، قال لي أنا عارف الوقت يعني كان قليل، فإنما إحنا قدها وقدود يعني ما. فأشكركم كلكم وعقبال كل مؤتمر. وقبل ما اقفل السيشن بقى، في اي سؤال بالنسبه للتوكس اللي اتقالت قبل كده ولا سالنا اول باول؟ طيب اوكي، شكرا ليكم، ونبتدي بقى السكند سيشن ان شاء الله. اوكي